The Atlanta TMD Institute is proud that it's so the Atlanta TMD Institute was founded in 2018. We have three main missions. One, to educate dental and medical professionals in TMD, to develop knowledge of temporomandibular disorders, because there's a lot of confusion right now in the United States, and to successfully treat patients suffering with TMD. Most of our patients are referred by dentists and practicing ENTs, physical therapists, neurologists, ear specialists. So this is our mission. But this particular TMD training course is part of a series of courses offered to train TMD assistants so that they can do outstanding jobs in the TMD clinic assisting patients chairside. This is a specific point in a patient's treatment, the 6 weeks after wearing the hard guard. The objective is for the patient to learn the therapeutic bite in a hinging or door motion, open and close, tap, tap, tap in the correct position. So you have to be sure that they've learned that. And once they've learned it, we remove the lingual ramps. That's the primary thing that we're doing at this particular point, and we're also evaluating whether the patient's neck has improved, because the head, neck, and jaw all work together. If there's problems with the neck, there are going to be problems with the jaw. So this is something that is critical. You should know at each point. So you're doing the patient self-evaluation of TMD treatment, one, and you look at there and you say, oh, gee, this is like 6 weeks or 7 weeks. We need to remove the ramps if the patients learn the therapeutic bite. We need to look to see if the neck has improved and do a physical therapy referral if needed, which is usually true. So just for some clarification, POHG6 stands for post, means after, right? O for operative, like operation, post-operative. It's just a term we use in dentistry to follow up after something. Post-operative. H means hard. It is a hard acrylic appliance, and we call it a guard. I don't really like all this terminology, but we just use it, right? Hard guard. It's just a term that's been used for many, many, many years, and it's slipped into our terminology. Perhaps we'll change it. We don't know. But 6 means 6 weeks. The patient has worn the MORA, mandibular orthopedic repositioning appliance, lower, or the hard guard is what we also refer to it, because it's easier to say hard guard than mandibular orthopedic repositioning appliance. And the patient has worn this appliance for 6 weeks. Now we've got to do several things. We have to check several things. We want to make sure our progress is going well. 6 weeks is a big time, and it's mostly managed by the dental assistant, the TMD assistant, who should be you watching this video. As I'm sure you've already noticed, we do specific things at specific weeks. The patient has 26 weeks, half a year, of prepaid or free, it's not free because they prepaid it, care. And we do different things at different times. You should know this. And you should memorize what we do at each week so that you are familiar and ensure that the proper patient care is delivered, okay? So the TMD patient is evaluated on a week-by-week basis. In other words, depending on how many weeks that the patient has been wearing the hard guard, we do different things. And we're reviewing the 6-week period. At 6 weeks of hard guard MORA, mandibular orthopedic repositioning appliance therapy, 2 things are done. What are those things? The first thing is the removal of the posterior lingual guide ramps, lingual ramps, right? That guide the bite into the therapeutic bite. It's a slide, like a water slide or a slide in a park. The second thing is evaluation of the head and neck range of motion, the motion of the head, and a probable, meaning we're probably going to do this, referral to a trained physical therapist. When I say trained, I don't mean just any physical therapist. I mean a trained one who knows how to do cervical manipulation. You put your hands up. Those are manus, M-U-M-A-N-U-S. Manual labor is when you're using your hand. Manual therapy is when the therapist uses their hands. Many PTs do not use their hands and will not lay hands on our patients, but yet will collect $180 every visit for treatment that we didn't request and treatment that will not get the patient better. They have to lay hands. Again, over and over and over, I'm teaching, so you'll memorize all the things that need to be done so that we avoid trouble. First of all, we want to take the best care we possibly can of our patients. We're here to help them, right? We're not here to hurt patients. But you can hurt a patient by being thoughtless. An excellent and competent TMD assistant is always aware of how many weeks this patient has worn his or her hard guard. You know this. Why? Because you do the patient self-evaluation before the dentist comes into the operatory and checks the patient. You look at the number of weeks on the bottom of the patient's TMD patient self-evaluation form, and it shows you the DHG date, and then the administrative assistant counts the day before the number of weeks since the DHG date and circles the number of weeks. You look down and you say, how many weeks? Every time you do one of these, you say, well, how many weeks has the patient been wearing this hard guard? How many weeks has this patient been wearing this hard guard? How many weeks has this patient been wearing this hard guard? You always, every single time you see a patient, ask yourself and look. And sometimes we do have somebody who's not too bright, and the day before they're supposed to look at the, put the DHG date in there, put the DSG date in there, and they're supposed to put those dates in and calculate this. If they don't do it, we have a problem. You could then slip into a incompetent mode because you're not reprimanding or working with that other individual. And that's what happens a lot. The other person doesn't do it, then you do it, and then finally you're doing it all the time when it's their responsibility. So they're getting paid to do nothing. You're getting paid to do twice the work. You need to always ensure that these forms are filled out the day before. Now, failure to know how many weeks of a hard guard wear has passed can result in a dental malpractice case. It means a lawyer comes, gets all the records that I wrote that you wrote, looks to see if we did what we were supposed to do, and tries to find out if we committed malpractice. Mal means bad, practice means, taking care of patients. And if you are incompetent, you're going to place the dentist in trouble, but even worse, you're going to hurt the patient. So I'm trying to emphasize how important it is that you know how many weeks the patient has been wearing this, because we are required to do certain things at certain times. And if we do not do it, we're incompetent. See, you might not think you're incompetent. Well, I'm a really good person. I love patients, but then you forget to do like the POSG6. And sometimes this happens, the patient will miss their POHG6 appointment, and they'll come in at 12 and miss the 6, and you don't even look back to see if we did everything we needed to do at the 6. Because at 6, we're supposed to do certain things. So when we go to 13, the things that we're supposed to have done at 6 should have been done. So you're thinking about this all the time. Did we do the POSG6? You really need to spend some time memorizing this TMD patient self-evaluation form so that you know how to work with it and you know how to read it. So you're becoming really a highly trained professional. And one of your big tools is every time the patient comes in, you are looking at the TMD patient self-evaluation form, and you are looking to see how many weeks have passed by. Now, there are other things to be aware of, but this particular video is concentrating on your awareness of 6 weeks. And sometimes patients will come in at 5, sometimes they'll come in at 7, but it's by 7, we have to do the 6 week, right? 5, we may or may not do the 6 week, but if it's 5 weeks, we screwed up, we're supposed to do it at 6. There's supposed to be a DHG, 1 week later, the first POHG, and then 6 weeks after the DHG, the 6 week. These are required appointments. They need to be in your head, in your mind, in your thoughts. And sometimes incompetent front office staff will cancel an appointment. Let's say you made a POSG6, and the patient calls up and says, gee, I can't come in, blah, 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 blah. And then they make another appointment 4 to 6 weeks later. And now we're in POSG 13 or 12, and you didn't do 6 because someone cut you down behind, you didn't know it, and they cut you down at the knees. And now you can become stupid by not doing the things you're supposed to, right? Was there a POSG 6? You know, and you can always look at the notes to see if it occurred. So one of the things I'm trying to do is to create a team of caring, loving people who work together very well. That doesn't happen unless there's a caring interaction between the staff members. And so often we have difficulty simply because one staff member doesn't want to talk to the other staff member. And bad things happen and nobody ever rings the alarm bell. But you've got to, because if we're a real good team, everybody's going to do their job. The bottom of the TMD patient self-evaluation form shows the DHG date. This is the date that we deliver the hard guard. Also, the number of weeks have been calculated that have passed since the DHG, because this is what we're talking about. We have a POHG 6 weeks, and you got to know how many weeks has it been since the DHG has passed. You can't treat that patient until we see that. So if you get the patient self-evaluation form, and you start doing all your POHG activity, and you never look down and see the number of weeks, you're screwing up. You really are messing up. And the other employee who is supposed to put it there is messing up, really messing up. And you can't blame that other employee because you are responsible to ensure that the other employee does it. So if they don't do their work, you need to talk to them and say, listen, you need to put this down so I know what's going on, and please fill these out properly the day before. So this particular form is filled out the day before by the staff member who did the pre-appointment account review. Pre means before. So the day before, they looked in the ledger, they looked at the DHG date, they put it in the form, and then they calculated the number of weeks since the DHG and circled it. And when you look down, it's already there for you. You don't have to open the ledger, and everything's wonderful, and you know what has to be done. And at the visit that we're concentrating on is the 6-week visit, because there's specific things that must be done at 6 weeks. If it's not filled in, then the other staff member is getting paid to do nothing. You're covering their butt. You're trying to protect them. Meanwhile, you're making your job harder, and there's less time with the patient, and you're just not being excellent. We don't have a team, do we? It's just not okay. And if it's not filled out, if it's not filled in, then this other staff member is getting paid to do nothing and making the dentist's and your job more difficult. This is not a team member, and we've got to do something about it. You got to care. You have to help me create this team. Now, if you get really good, at being with me, 6 months a year, I'll allow you to do these range of motions. But you've got to really know what you're doing. You got to know what 45 degrees is, 90 degrees, 60 degrees, 30 degrees. You need to know all these things. But almost all TMD patients have a neck problem. because the neck and the jaw joint, are related a lot. There are hundreds and hundreds of medical scientific papers showing this. So the temporomandibular joint function can sometimes be limited and not get better if the neck is a problem. And these people have sleep problems because of their neck. They can't function well. They get into car accidents because they can't turn their head to look to the sides. So this is really important. So at 6 weeks, we evaluate the head and the neck, and we call it range of motion. In other words, the movement of the head on the neck and how far it can move. And it's supposed to move a certain amount, and we'll talk about this. So there are 2 head movements that we look at. There's actually 3 total, but we don't look at forward and back like a nodding motion when someone nods. We don't measure that. I don't think this is important. Really, what I think is important is the side bending. The most important is side bending. Rotation is also important. So side bending means you sit there, keep your shoulders straight, not rotate, don't rotate, just bend to the right, bend to the left. You should be able to go 45 degrees. Rotation, you should be able to go from shoulder to shoulder. Like the chin should be over the shoulder on each side. So there are 2 head movements that that are evaluated by the attending dentist at 6 weeks of hard guard wear. And if you don't know it's 6 weeks, we're not going to do this. And if it's blank and you don't pull up the ledger and find out what's going on, we're not going to do it. And there are going to be problems, and you created it. I'm just trying, I don't want to scare you. I just want you to think, I want to take care of my patients. Wow. And I know this is what I've got to do at 6 weeks, and let's get the doctor in. And if you've been with me 6 months or a year and I certify you, you'll be able to do this quick check for me, no problem. So the first is rotation of the head on the cervical spine. Cervical means neck. It's a fancy way. You wouldn't say neck to another doctor. You'd say cervical spine, all right? And you sit back in a chair and you rotate your head to the right. It should go above your shoulders. The chin should go above the shoulder, and that should be 90 degrees. And you need to know the degrees. What's 90 degrees? You should know. It's like a quarter of a slice of a pie. The second movement, which is more important, is side to side bending. So the shoulders don't move. You'll see patients move their shoulders, or they'll put their head forward and rotate. No, you just sit, head straight, bend to the right, bend to the left, no pulling the shoulders, no going forward, just a pure side bend, right? These are the 2 things that we look at in TMD. So it's interesting, you see this young lady bending her head, and there are 2 head movements that are evaluated by the attending dentist at 6 weeks of hard guard wear. More aware. You could possibly learn how to do this if you're here for 6 months or a year and understand degrees and measurements. The first rotation of the head on is the first motion is rotation, like a wheel, turning of the wheel, except the head can't turn all the way around unless you're, possessed. The first is rotation of the head on the cervical spine, which should be 90 degrees. She's bending side to side with the shoulders straight. And the second movement that we evaluate is side to side bending on the neck. And so rotation and side bending. And the shoulders should be straight in both. And so it's extremely important that you understand this. And it's at 6 weeks. So the first thing we're going to look at is head rotation. We spoke about that, and I'm giving you some things you must do. You must keep the patient's shoulders horizontal, meaning, parallel to the floor, or sometimes one's higher than the other, and they sit the back against the chair and they're sitting straight, and they simply, without moving their shoulders, rotate to the right. The shoulders are not allowed to move as the patient rotates his or her head from the side to side. If the patient moves the shoulders, stop, you can't measure that because we're looking at the head rotating, not the shoulders rotating. Got it? Just the head, not the shoulders. Should be no movement of the shoulders. Many patients will extend their shoulders to achieve a normal bending. So they'll actually go to the right and then they'll pull their right shoulder up so they can touch, but that's not okay. That's not a real side bend. The shoulder has to stay relaxed with no movement. But using the shoulders to rotate the head is not a normal thing. And now you know that there's an abnormality. There's a problem. This patient has a head bending problem, a head rotation problem, okay? What is normal? Normal head rotation is 75 to 90 degrees, and I like 90 degrees. I want them to be loose as a goose, move around beautifully. That means that the bones, the nerves, and the muscles are all happy, healthy, and doing really, really well. Remember, when we see abnormal bending, rotation, or bending, we know that that there's a problem with the muscles, there's a problem with the bones, there's a problem with the discs, there's a problem with the nerves. We need to correct that for this patient. So when we look at how the cervical spine works, in other words, the bones and muscles inside the neck, rotation of the head happens on the first two vertebrae. Vertebra is part of your spine. Your spine has different bones. There's a disc between each bone. Sometimes you hear about slip discs. But the first two bones are very, very special, and they have very special names. One is atlas, A-T-L-A-S. That's you've ever seen these things where the world is being held up by Atlas. That's his name. He's a Titan. And Zeus said, you have to hold up the world, and you can Google this. Atlas holds up the skull. Axis, like you rotate your bicycle on the spoke, go around the axis, and you see there's something called a dens, and the atlas rotates around the dens. You can see that there. So rotation of the head happens primarily between the top two cervical neck vertebra, C1, cervical vertebra 1, atlas, and C2, cervical vertebra 2, axis. And it's very rare to find problems with head rotation. You can have a totally messed up cervical spine. There's 7 cervical vertebrae. You can have 5 of them messed up, but if atlas and axis are functioning well, you can still rotate. So you can get a patient to rotate to the right 90 degrees and rotate to the left 90 degrees, all totally okay, but then be totally messed up with cervical vertebra 3, 4, 5, 6, and 7. There are only 7 of these cervical vertebrae, but that's what we're looking at. So we have a picture of the cervical spine from the side. The right is the side. There's spines coming out of the back of each one of the cervical vertebrae, the cervical bones. Notice that they get larger as you go down. And there's 7 of them. If you look at the left one, there's something called the vertebral vertebra, vertebral artery, the red, and it goes through the sides, the transverse processes, all the way up to the base of the brain, goes up through foramen magnum, the big giant hole. It's not a really important artery. And then as you look at this picture, the blue parts between the bones are the discs. They are fibrous like pillows, thick pillows. And then you have nerves coming out of the sides of the vertebra in between the sandwiches. So right at the level of the discs, there are nerves on both sides. Those are yellow. And those are really, really important. Those nerves control the neck and the arms, moving the arms around. The normal side bending of the head with the shoulder stable is 45 degrees. So we looked at rotation, C1, C2. Now we're looking at side bending, which is C3 through C7. C meaning cervical vertebra, 7 of them. So just the same as with rotation, the shoulders must be kept steady and are not allowed to move. Two measurements are taken, side bending to the left and side bending to the right. And she is raising her shoulders slightly. So if she goes, as you look at her straight, she's going to the middle, either side, the opposite side is raised up. It shouldn't be, it should be horizontal. But this is considered normal side bending, bending to the side, but the shoulders should be straight. That's a problem with this particular illustration. Most older TMD patients over the age of 22 have a side bending problem at the end of 6 weeks. And that, I mean, when they first came, they had the side bending problem, but at the end of 6 weeks, they still have it. It may be better, but they still have it. What does that mean? They can't rotate their head, and they can't bend 45 degrees, and they can't go forward and back, but we don't measure forward and back. These patients will not be able to bend 45 degrees to one or both sides. So if they move abnormally to one side, they have to be referred. If they move abnormally to both sides, they have to be referred. So sometimes they'll move to the right normally, 45 degrees, and the left, they go 10. But they can't. And if you saw the arteries and the nerves coming out of the vertebra, they're all pinched. Oh, my Lord. And that means the head can't move really well because the neck can't move very well. And when the head can't move very well, the jaw can't move very well. And the jaw, the jawbone's connected to the neck bone, all this stuff. It's all connected. Under 22 is amazing. I just have seen amazing things. Young kids, they're amazing. They'll come in, they can't bend at all, and 6 weeks later, they're fully normal, or they're even more than fully normal. But over 22, they tend not to be. It seems to be the cutoff. And I say 22 because it tends to be college age. So 22 is the end of the college age. These older TMD patients must, MUST, be referred to a competent, a person who knows what they're doing. Don't assume all men are the same. I'll marry any man. They're all the same. Patients truly believe this. They believe any physical therapist is the same. Well, that's not true. That's like any physician is the same. No, physicians have specialties. They're all physicians, they're all MDs, but they have specialties. One does kidneys, one does heart, one does brain, neurology, one does ear, nose, and throat, right? One does podiatry. They're all different, and the same is true with physical therapists. Not all physical therapists like to use their hands. So we want to refer to a competent, trained physical therapist who is knowledgeable in manual therapy and vertebral mobilization. What does that mean? Manual, manus, M-A-N-U-S, means hand. Manual labor is labor with your hands. Manual therapy means the physical therapist must lay hands on the patient's neck and work that neck with fingers and hands. They don't like doing that. It's a lot of work. And they get tired throughout the day, and they don't want to do it. And what are they doing? With their hands, with their manual therapy, they're doing something called vertebral. That's the vertebra. Remember the 7 of them? And they're all stuck, and they're pinching the nerves, and they're cutting off the blood. Mobilization, meaning those natural vertebrae should be able to move around, float around, flex around, so that the head will be totally able to do whatever it wants. But when you can't bend one side to the other, it means that they're stiff and stuck. And the physical therapist, using their hands on the lateral processes and the spinal processes, moves them around slowly until they start moving beautifully. It is a hard, laborious treatment. Not everybody does it. We do have specialties or actual manual therapists. In other words, there are physical therapists that advertise that they are manual therapists. And there is a manual therapy organization for physical therapists. And we got to be very careful who we refer to, because just recently we had a person with Medicare went 20 visits. They didn't lay hands on the neck, even though that was the prescription. And it was a physical therapy assistant and not a physical therapist. I don't know. I want to cry. She didn't get better. If it's $180 each visit, 10 visits, 1,800, 20 visits, 3,600. They are ripping off Medicare. It's a ripoff. And people do this. There's a lot of unethical behavior in the physical therapy population. And so we have to be always asking, how's your physical therapy going? And if you're really good, you're really, really good, you might be checking the side bending for me and rotation after we refer to see if things are going well and to see if the physical therapist is indeed laying hands on that patient. And if you wish, I would be happy to work your neck. So to show you what they're supposed to do, so when you talk to the patient, you'll know what to look for. So 6 weeks is the mandatory period. There is a mandatory, we have to, you can't say no. Patient says no, who cares? We must, it's mandatory. There is a mandatory physical therapy referral if there is limited side bendings at 6 weeks. So we always look at the side bending at 6 weeks, and we always refer to a knowledgeable physical therapist at 6 weeks, regardless what the patient says. Why? Legal. Oh, I never got better from Dr. Podolsky's treatment. He did sucky. And it's like, whoa, did you go to physical therapy? I don't need to. That's my neck. Well, the neck and the jaw function. There are numerous papers, scientific research showing when the neck improves, the jaw will improve, and vice versa. Okay? Geez Louise, do we sometimes have problems? The answer is yes. Pre means before. Script, scriptures, the writings. Script means to write. Prescription means to write before. So when we do a physical therapy prescription, it is a written prescription telling the physical therapist before she starts what she's supposed to do. And it's a referral because it's another healthcare practitioner. I receive referrals, TMD referrals. So a physical therapy referral prescription must be filled out even if the patient protests. I don't care. Let me tell you. We've had patients who did not go to their physical therapy and they went at the end of 6 months, they're done with their therapy, they must pay after that, and they finally go to PT and say, isn't it wonderful? And I'm like, you went too late. And then the physical therapist wants advice after I have completed my obligation, financial obligation, and I have to charge for it, and the poor patient screams and yells, but they created the problem. And I want them to get better. Oh my God. So I don't care if they protest. I know that they're going to get better with physical therapy. I know it. I see it. And strangely enough, some of the supposed dentists that do TMD in the area, one particular one, he says he's a specialist. He's not. He does not refer to PT. When I asked him one time, why don't you refer to PT? Because it sucks. It doesn't work. And that's true most of the time if you do not watch who you're referring to, if your prescription is not very specific, and unfortunately if you don't follow up, and they won't get better. So he just says, screw it. It's too much to manage these bastards, and I don't want to do it. And then it doesn't work. So you should establish a relationship with 1 or 2 or 3 people who really know what they're doing. And that way when you refer, you know that that physical therapist is excellent. And that's the difficulty. A lot of patients don't want to do this. They want to go to their own, and their own guy sucks. And they say, well, I'd like to go to a massage therapist. So, if you ask a massage therapist, what muscles are you touching and relaxing? They can't even tell you. They don't know the anatomy. They don't know the cervical spine, where the bones are and the nerves are, and they're going to fail. And it's going to be terrible because none of the massage therapists' costs are covered by insurance at all. Physical therapists, it's covered, especially Medicare. It's 100%. I mean, not 100%, but unlimited number of physical therapy visits. Manual therapy, hands-on therapy of the cervical spine is necessary for this patient to improve the TMD problems. If the dentist fails to refer, the patient will later blame the doctor. This happens all the time for this failure, for the TMD failure, when it really was the patient's fault. Come on. We want the patients healthy and happy. They can't bend their head and they don't care. Well, it's not hurting me. Don't do surgery on the cancer. It doesn't hurt. Let's wait until the cancer hurts. Then you can do the surgery. What the hell? The whole American medical system is like that. If you got a problem, you go to the physician. Whoa, why not do prevention? Shouldn't you go to the physician when you're healthy to prevent things so that way you stay healthy? Unfortunately, our system is broken and people are thinking broken. So this patient does not have a choice. They must go to physical therapy, and each time they come in, we're going to harass them because we care and love them. So the manual therapy must, I say must, that you have to, please listen, be performed by a trained is the key word, trained physical therapist. This person knows what they're doing. They understand what the prescription is about. They understand the problem and how they're going to solve it. Trained physical therapist who agrees in writing, they agree legally. They say, I'm going to do this. And then if they don't say that, I don't want them doing it, right? And we'll talk about that in a minute. So the manual therapy must be performed by a trained physical therapist who agrees to provide manual therapy and vertebral mobilization. Agrees. So they send us something called a plan of care. The plan of care after they evaluate the patient, what they're going to do, how they're going to solve the problem. It's in writing, just like our treatment plans. And we need to see manual therapy, vertebral mobilization. And a lot of times they want to make extra money. So they add a lot of extra stuff up in there to charge the insurance company more. So we have to be protective of our patients and be sure that our patients are getting what? Manual therapy and vertebral mobilization. I have had also physical therapists who could not get my patients' necks moving again. At least 2 times. I usually, like on a Monday evening, 5 o'clock, bring the patient in with the physical therapist. The physical therapist comes to my office, and then I do the mobilization in front of the patient, and I'll show them the range of motion changes. One particular one insisted that she couldn't get anything done after like 10 visits. I got mad. Instead of like threatening, I said, come in. And the patient was sitting there in op 1. I did the vertebral mobilization, and it went from 10 to 45 right in front of her after I did the mobilization. Meanwhile, she had already done 10 visits at $180 each, $1,800. She jumped in, took the job, thought she knew what she was doing, and the whole population of the world is littered with people who think they know what they're doing. This must be done by a physical therapist, not a massage therapist. A massage therapist sometimes doesn't even know the muscles they're touching. If you ask them what bone are you touching, they can't tell you. What nerves in that region, they can't tell you. They can't do anything. They're just like patting the patient down, massaging the patient, but not knowing what they're doing. Chiropractors are wonderful, but they're not very good for muscle problems. You see, if you've got a tightened muscle, they adjust bones. They put bones into position. We need them occasionally, absolutely. Sometimes we just can't get the cervical spine mobilized. And I will even try and I can't. We need it to be loosened up by a chiropractor because a chiropractor knows how to crack bones, loosen them, move them apart, unstick the bones. A physical therapist sucks at that. Matter of fact, several years ago, I was horrified that a physical therapist couldn't get the neck going. She called in another male physical therapist who was not part of our prescription or referral, who was not on the plan of care, and he took his stupid thumbs and jammed them in really hard in what they call thrust therapy, and the patient got sick and upset, and the TMD problem got bad. This guy didn't know what the hell he was doing. He hurt my patient. Having the physical, and I felt betrayed by the person we referred to. Having the physical therapy referral documented in writing, showing it in the patient's record, also proves that the patient refused needed care. So if we have it in the record and they don't do it, they're going to say later, we never told them. We're going to say, no, I'm sorry. We talked to you each time. At the bottom of the TMD patient self-report of progress is, how's the physical therapy going? We ask always legally. We ask legally. We make sure they're doing it legally. We insist upon it legally, and we document it legally at the bottom of that form. When you're done writing that physical therapy referral, scan the physical therapy referral prescription into PDF and attach it to the patient's Dentrix account. That's our protection. Physical therapy. A physical therapist is a licensed professional. They're trained, they go to school. Year after year now, they're getting more and more advanced. They went from a bachelor's degree to then a master's degree. Then now most of them are PhD. There's doctors of physical therapy. And that's caused a little bit of a problem because they can write their own prescriptions since they're doctors, but they don't always know what they're doing. So we get into trouble. But we write physical therapy prescriptions on the 6th week for most patients if they can't bend their head. There's paper after paper after paper proving that the neck and the jaw work together. And when the neck is healthy, the jaw is healthy, and vice versa. We've had young people, particularly, who have worn their appliances for 6 weeks and the head problems just disappear with no physical therapy. Crazy. I'm always amazed. Older people, however, their bones have grown weird, their muscles are tight, they're older, they really do need to go to physical therapy for generally about 10 visits or to 20. But we need to be very careful about our physical therapy referrals. Not all men are the same. You can't just marry any guy or marry any woman. I hope you'll get this very importantly, that there's differences in physical therapists and their ability and their ethics. And ethics means doing the right thing for the patient. A lot of them don't believe it's important to deliver excellent service. They just believe you come in, you do a little physical therapy, you see them again. Hey, let's drag this out for 100 visits. 100 visits times $180, that's $18,000. If I can do it, I'm going to do it. That's some unethical physical therapist will do this. The purpose, I believe, is for the physical therapist to heal the patient so they can move their head 45 degrees right and left, that they can rotate themselves and bend forward and back comfortably, sleep well, feel good, and get them out of physical therapy as soon as possible because there's no need once they're healed. Handwriting a physical therapy prescription. Pre means before, scribe means to write, to prescribe. Handwriting a physical therapy prescription for every single patient, filling in every single space the same over and over and over is time consuming. And we can avoid that because the prescription for all TMD patients almost always is the same. So since it's the same, we can create a master physical therapy referral form. So a master physical therapy referral form is pre-filled out with all of the Atlanta Tmd Institute doctor information filled in. So this is the doctor information. It's the same. I'm the same doctor no matter what. All of it, on all the prescriptions, it's going to be the same because it's the same doctor, referring doctor, me, right? So Atlanta Tmd Institute, our telephone number, the date, not the date, but all doctor information is the same. This master physical therapy form is then scanned to PDF Adobe portable document file and saved in commonly asked questions and also saved on the desktop of every computer in all operatories. This is for your convenience, for speed, so you won't have to run around all over the place. POHG6, we're going to probably do a referral. Since we know we're going to probably do a referral, let's make it easy to get that referral written and send out. So this master form has to do with one particular company, but let's clarify. The same form can be used for any physical therapy. So you might have it for an actual physical therapy form for treatment for a company A, PT Solutions, and then. But it can be used, the prescription is the same. You can fill any Keflex prescription or Tylenol 3 prescription in any pharmacy, you see. So The form is filled out as much as possible, leaving the patient's name, the amount of treatment needed out, but we know the type of treatment that each and every patient needs. This master physical therapy form is then scanned to the PDF and saved in commonly asked questions and on the desktop of every computer in all operatories. The problem with commonly asked questions is, we may update it continually, but we don't actually copy it and reinstall in every computer. So we have this master commonly asked questions, which is located in the TMD building, and we update that periodically, except that the one that's in, let's say, the hygiene area, that was put in a year ago, and there's no updates on that. It's an older version. So that's why we put everything on the desktop itself too. So when a patient needs a physical therapy referral, the TMD assistant then prints out the pre-filled out PDF physical therapy form. You just print it out. Of course, then you put in the patient's name, today's date, and how many times the patient needs to be seen. And we like them to be seen often. Even though the physical therapy prescription is for a specific physical therapy company, it can be used by any physical therapist or any other physical therapy company. That's very important to understand that. So you might say, well, Dr. P, we don't have the physical therapy prescription for motion stability. Well, we don't have to. We can write it on the PT Solutions, and it can be brought to motion stability, and they'll accept that because it's a prescription for a patient needing physical therapy, right? Not a specific company. So at 6 weeks, it's almost good to print it out anyhow, anyway, because the chances are like 90% or more that we are going to make that referral. This is why you need to be paying attention to the number of weeks since the DHG. This is one of my bugaboos. In other words, one of my pet peeves, one of the things that I don't know why I can't get it into the minds of the assistants that, hey, I've got to know how long this patient's been wearing the hard guard. So the hard guard, the mandibular orthopedic repositioning appliance, repositions the jaw, and then the neck tries to correct itself. But the patient's been like this for years. Most of our patients are over 22 and they're older, and all the things that have gone in their neck previously has been like part of them, and it has to be changed, and it's not changed easily. So almost always patients will start having some neck pain after we put the appliance in. Hey, that makes sense because when you put the appliance in, it straightens out the head. Now the neck has to change, and the neck has been in trouble for years. So we send out at 6 weeks, and we allow 6 weeks for the changes to occur. We don't send to PT earlier unless there's a specific problem. The protocol, which means the step-by-step method of how we do things, indicates that most patients are sent out at 6 weeks. Sometimes people come in and they're a total wreck, and I'm going to break that protocol, and I will send out to PT immediately because the person's a wreck, and we've got to do as much as we can. Sometimes people say throw the kitchen sink at them. Everything has to be done. But we know at 6 weeks, and if you don't look at the form, and if you're not precise and you're not excellent, and I have always thought this is such an easy thing. If the form is not filled out, we have a problem because you're going to miss the PT referral. Patient's going to suffer, and it's your fault, my fault. I should have said, where's the circle? I want to know how many weeks it's been. And then I get into a fight with you, and I feel like you don't care, and you don't because you know that needs to be circled, and you're supposed to read that form. Otherwise, you're walking around in a dream, and you don't even know what's going on. And I submit to you that your concern and love for the patient requires you to read this form and make sure it's filled out correctly so we can provide the correct care for this patient. And if there's no circle there, you're not going to do that. You're not part of a real caring team. So again, after the pre-filled form is printed out, the TMD assistant adds the patient's name and personal information to the pre-filled form, like patient's telephone number, whatever it might be. This avoids having to fill out all of the Atlanta TMD Institute's information each time a physical therapy prescription referral is made. The completed physical therapy referral form is scanned into PDF. So you fill out the name, you fill out the date, you fill out how often they need the therapy, and you're done with the form. Now you scan it in a PDF. We have several Toshiba scanners, and then you put it into the patient's document center in Dentrix. You must put the scanned form into the patient's document center in Dentrix because we made that referral. We asked for a very specific type of therapy. And if later there's an investigation and the patient didn't get better, we will go back to the physical therapist to prove they didn't provide the care that we wrote out. And let me tell you, physical therapy is one of the most bogus professions that I've ever seen in my life. And you might say, that's a pretty harsh statement. And it's because just like in medicine, which has the average 7-minute visit, physical therapy has been pushed, and a lot of high income, profit-making physical therapy companies now will see 4 people in 1 hour, and you can't see 4 people in 1 hour. There's no possible way. So literally, they'll put someone on a bicycle, I'm not kidding you, at $180 an hour, and in one place, $330 an hour. They will put the person on a bicycle for 15 minutes, and if it's $330 per hour, let's just say 300. Half 300 is 150, then half of the 150 is $75. So they're riding on that bicycle, and they're being charged $75. That is a ripoff. And they'll sometimes, maybe they'll make it up by having an assistant for the physical therapist. But you can't see 4 patients at the same time. And you can't actually do hands-on in an appointment where you have 4 people. It's just really difficult. And so many of our referrals, we find out one up in Berry College, the young lady had 10 visits with a big conglomerate physical therapist. And we sent the patient up for manual therapy, manus means hands, and to work into the bones and move the bones and mobilize them, get them moving really well. And in the 10 visits, the physical therapist never once laid hands upon the patient. They don't want to do the heavy, hard work. Can you imagine doing hard work for 8 hours a day or seeing 2 patients at the same time doing hard work all the time? You can't do it, and they're not going to do it. They won't do it. They need to see 1 patient per hour, but they're not. So this particular young lady was going to Berry College, and her parents, they didn't have medical insurance. So physical therapy was not covered. And at that time, it was $180 a visit. And I called the company, and I said, listen, this woman committed malpractice, and my patient didn't get better, and I need your help. You got to make this up. So they said, sure, no problem, Dr. Podolsky, we'll take care of it. Don't you worry. And then I found out later that it was being paid by her grandparents, who were retired farmers, paid $1,800 out of their retirement money to take care of their granddaughter. And this company offered like 10 more visits, but charging $50 a visit. And they shouldn't have done any of that because they didn't do any of the prescription. There you go. That's my rant and rage. That's why you have to put this scanned physical therapy prescription that I made into the patient's Dentrix file. Court case comes, and it is not my fault that the physical therapist failed to do her duty. But I'm trapped under a rock with this. Again, the completed physical therapy referral is scanned into PDF, and the scanned completed form is stored in this patient's Dentrix document file. Quite interestingly, almost all TMD physical therapy prescriptions for all TMD patients are the same, since all of our TMD patients have TMD, which causes the same type of cervical problems for all patients. So what you write is shown below inside the prescription. I think I might ought to just make a generic one. And these are things I want you to think about when I say them, when you see them, and spend some time inquiring what I'm saying. I'm going to try to explain it to you, but it's critical as a healthcare provider that you ensure that your patient, like your child, gets treated well. Got it? I think the first confusion is physical therapists will actually sometimes stick their hands in my patient's mouth without permission, without request. I am sending the patient over simply initially for cervical physical therapy only. Cervical is the neck. I believe strongly that if I'm doing a good job, that my mandibular range of motion will be normal or close to normal. I did my job of calming down both jaw joints, and I have made progress. And that's my job. The physical therapist's job is to get that cervical spine flexible, movable, mobilized, so it can move around any which way it wants. And that will help me tremendously. But so often we get physical therapists wanting to do injections in the mouth, but very often, get this, the pain in the side of the mouth, the temples, below the eye, everywhere else, all that's coming from cervical problems. But they don't know the referral patterns. So again, I want to stress they are doing the cervical physical therapy only. And when you talk with them and when you look at plan of care from physical therapists, these are the things you've got to know. So we order the first thing is cervical vertebral mobilization. Cervical means neck, and vertebral is the actual bones in the neck called the cervical vertebra. You can look this up online. You can look at pictures. And mobilization means to make them move. So often they're kind of stuck together hard and they don't move. And that's the problem. The patient has to swing his shoulders over to the left, to the right, can't move her head. The whole shoulder has to move. But in a normal person, they can just turn their head fully or laterally bend side to side with no problem. Manus means hand. Manual therapy means hands-on therapy. And there is the problem. Because I used to just write manual therapy, and people, and these inefficient, tricky-dicky physical therapists will say, well, I put my hands on the patient. I did manual therapy. But they never went into the vertebra and moved them and, made them more flexible. They didn't do any of the actual deep hands-on work on the actual bones in the neck. Moist, warm heat is really important because especially after you've done some work on a patient's neck, it's going to hurt a little bit. Toxins are going to be released, and they need that heat to keep the blood supply in and out to clean everything out. Spray and stretch is a cold spray that you spray on the muscles. It shocks them, they tense, and then they release. So you can actually get the head to move much easier after using spray and stretch. And we also make notations. Please check lateral side bends at every appointment. They won't do that, but we want to put that in. If they're really super duper, they'll do it, but it's just extra work and they'll forget. They don't do that in normal patients. This crazy dentist is actually wanting them to get results. I'm sending them over there to increase, range of motion, to increase their mobilization, to get the results. I just don't want to like the pitcher at the baseball game. I want him to win games for me. If he goes in and everybody's hitting, base hits and home runs, and I'm losing every game, that's not. Who cares if I like him? He sucks. I don't want him as my pitcher. The purpose of sending that patient over to physical therapy is to get that patient to move lateral side bends to 45 degrees each side. Please have patient wear the TMD appliance at all physical therapy appointments. Having that appliance in helps the head go back to where it's supposed to be. Very important. All of these things are extremely important. And you can very often, if you get really good, and I hope you do, I really hope you do, because it's going to decrease my work, it's going to improve patient care, and you'll have your patient population and legally be able to provide most of this therapy or interaction with other professionals for me. And I'm really happy you do it, but you've got to know what you're doing. So again, this is part of the physical therapy referral, and I think I'm going to eventually make a common physical therapy referral that we issue rather than putting it on their prescription pads. They really are supposed to have prescription pads, but more and more, particularly the rural ones, they don't. And it gets to be a little bit of a problem. However, a physical therapy prescription can be used anywhere. So if I write one for XYZ Physical Therapy Associates, then ABC Physical Therapy Associates can use it also. The Latin word for hand is manus, M-A-N-U-S. I've got a hand here. Manual labor is work done with your hands. You are ordering the physical therapist to lay hands upon this patient's neck and to move the vertebra around so they get used to moving around. A normal cervical vertebra can move slightly right and left, up and down, so that the head can turn and move. That's a normal neck. Mobilization means movement, to get things going. We're mobilizing something, getting it going. And this guy's head is amazing, isn't it? Our patient's cervical vertebrae are stuck. They don't move because the patient's neck muscles are tightened and rock hard from years of bending out of place and holding the vertebra out of place. And the vertebrae are not moving either. The ligaments are tightened and the discs are sticky and everything just needs to be moved around so it will start moving again. And that's what mobilization is all about. And this is cervical vertebra mobilization term at the very top. And this is a very important term. We used to say manual therapy, but we've had some physical therapists say, oh, I used my hands, therefore I did manual therapy. No, we want you to mobilize the cervical vertebra so that they move about normally. The cervical bones, the cervical vertebra, the stuck cervical vertebra must be moved and unstuck with the physical therapist's hands and fingers, and a lot of physical therapists don't want to do this. It's too much work. They are seeing too many patients in an 8-hour day. Some of them are seeing 4 patients an hour. Therefore, they're seeing 32 patients a day. Can you imagine if they're doing cervical mobilization, cervical vertebral mobilization, everybody? So not every physical therapist is for us. Not every physical therapist is for this patient, and not every physical therapist is going to provide the correct cervical vertebra therapy that we need and that our patients need. It's hard work, but it's almost always successful, and I've seen it. I also very often will invite physical therapists to bring their patients to my office at 5 o'clock on Monday evenings. I had one physical therapist come over a year or two ago and said, you cannot mobilize this woman. We can't move this head left and right 45 degrees. Well, within 20 minutes to a half hour, in front of the physical therapist, I had the patient moving left and right 45 degrees. And I am not a physical therapist. I do not have a master's nor PhD in physical therapy, but I know my anatomy and I know what causes what, and I know that patients can heal And I believe in nature and God. I believe that we can heal our patients. And it's essential in order to be healthy that your cervical vertebra move, your neck moves, your TMD condition is also related to it. So unless we take care of this neck, we're going to have a lot of problems with the TMD signs and symptoms. There is an organization of physical therapists that specializes or emphasizes manual therapy. And the name of the organization is the American Academy of Orthopedic Manual Physical Therapists. You can go on their website, and below you see https://AAOMPT.org, org meaning nonprofit. And you can see if there is a physical therapist in the area that the patient lives. The problem is that most of these manual therapists are city dwellers, very few rural. I think there's like one in Dawsonville, and they're spread out, and you can open it up and put Georgia in and look to see where the closest ones are. And so I like to refer to these guys because that's their emphasis, and they're going to lay hands upon my patients and hopefully increase the side bending to the degree where the patient gets significantly better. I am constantly having problems with physical therapy, and it is extremely frustrating. So many physical therapists are highly unethical, partly because the companies they work for have them see multiple patients so they can make lots and lots of money, and they're not geared towards providing excellent, fantastic treatment. And that's happening also in the medical community because the average visit's 7 minutes. Used to be my doctor would come out to my home, right? Check me out when I was a kid. This doesn't happen anymore. But this section is physical therapy problems. The first thing that we see is failure to provide hands-on manual therapy and spinal mobilization. They don't touch the patient, and if you ask the patient will say, oh yeah, she touched me. Then I've gone in, and you really can't, you're not a physical therapist. My license allows me to do some hands-on stuff, and I'll go in and I'll actually do some mobilization, vertebral mobilization, and they'll hurt, and they'll say, I'll ask, well, has your physical therapist been doing this? No. I said, does that hurt good? Yeah, it does. I mean, it feels like it's needed, but hurts. And the physical therapist never did it. Some of them never did it at all. Some of them started it and the patient heard it and they didn't want to do it anymore. But whatever happened, they did not provide the care that we requested. And then they'll do 10 visits, and it's $180 a visit very often, $1,800. They'll take all that cash money and put it in their pocket, and then they won't provide the care. And this is true. I'm not lying. It's most common. I'm going to say 2 out of 3 of the patients that we refer out, this is the situation. And this is why you must check the lateral side bending of every single patient that has been referred to physical therapy. Why? Because if no results are being obtained, we should identify that early, stop the treatment of this incompetent physical therapist, and refer to someone who is competent. And this is just the way it is. We have to police the physical therapists. Second thing is, very often these physical therapists will treat, I'm not lying to you, 3 or 4 patients all at the same time, and they don't provide an hour of therapy to our patients. Manual therapy is intense. It's hands-on, putting your fingers in and moving the vertebrae in opposite directions and stretching them up and down. It's a lot of work, and you have to stay there with that patient at least 15 minutes, right? At least 15 minutes, and they don't because they're splitting their time in 3 or 4 other patients. And I believe that's criminal. I really do. But there's no laws against it in Georgia or the United States, and insurance companies are almost promoting it because they don't really care, right? They're just interested in decreasing their costs. And the physical therapy organizations, particularly the bigger ones, they're interested in increasing profits. So excellent patient care is not the objective increased income is. And as you see the bigger ones, I don't want to mention any names, but bigger names, and I can talk with you about them, you'll start seeing that they are treating multiple patients, sometimes as many as 4 at the same time. I don't see how you can provide hands-on physical therapy that way. I've also had situations where having the physical therapy assistant provide most of the physical therapy instead of the physical therapist. I think that should be illegal, but it does happen. Uh, I hurt my knee a few years back, and I wanted to do some physical therapy, and they referred me, a big orthopedic company, Benchmark, referred me to a physical therapist. They had their own in-house. Well, it wasn't a physical therapist. It was a trainer, and she talked at me like a robot. I mean, she could have put that on a PowerPoint or put it on audio video. Everything she said and did is the same for every single patient with the handouts. She was a handout girl, and it was quite annoying. And I felt, I didn't argue with her or complain, but this is what they were doing. They would, and I am absolutely sure that that trainer is not getting paid anywhere close to what a physical therapist gets paid, but they did bill out for physical therapy. Only giving our patient handouts and reviewing the handouts at each appointment instead of actually doing any physical therapy. This was the first thing that brought my attention probably about 10 years ago. A young, pretty college girl, tall, blue-eyed, very thin, and she was going to school in North Georgia, not North Georgia College, but one of those, it's a big college, has a big campus, rural. And she wanted to go to physical therapy close to where she was at school because it's an hour and a half drive in. And then she had miserable results. She came in 6, 8 weeks because she couldn't come in all the time because of classes, no results. Her parents did not pay for that physical therapy. Her grandparents, retired farmers, paid $1,800 to a very large corporation. It turns out the physical therapist never ever in 10 visits touched the patient's neck. I was livid. So I called the head of the, one of the big wigs in that company, and they said, oh, well, we'll help her then. And then I found out later, they, instead of helping her, instead of $180 a session, they continued to bill, but at $50 a session. I can't believe it. It was really crazy too, because this particular young lady, I felt so bad for her that I set up some appointments for me to do the physical therapy. And boy, she just complained at me because I wasn't providing her like full, she just complained. And I was doing it at my lunch. But just the way it is, this is what I'm seeing in physical therapy right now. And you need to know it so that you can help me. And we want to be nice people, and we want to guide our patients. And we also want to keep policing the physical therapists in a nice way so that we can interact with them. But sometimes you interact and they get very mad. They know, very many of them, that they're seeing 4 patients an hour and there's no way they can provide excellent care, and that this particular patient got screwed. And they know that. And sometimes they'll react by getting mad at you. And it's just a sad, sad statement. Other problems that occur will refer a patient to physical therapy, and they won't go. They just, well, I don't want to pay the $25 copay. And they'll say that to you. They say, well, Dr. Badowski, I paid you so much money, I don't have any money anymore for anything. And they'd say this to you. But when we first met with them at the CNT and in our consent form, it specifically states that if we need to send you out to physical therapy or medical appointments for related things, you're going to do it. And then what happens is terribly, these very bad patients later complain. And they don't go to physical therapy, and they have 6 months of free paid, prepaid care, and they finally go to physical therapy late, and now they don't have prepaid care anymore, and you have to charge them to come, and they are mad. So they don't do what they're told to do. Then they get wicked mad at you that you're charging them when in fact they extended their care without your permission. It's just a very difficult situation because patients are people and people do things like this. They procrastinate, they don't listen. They came in to see me and paid a very large amount of money for me to give them advice to get better, and they don't take the advice. All right? Some patients, they go to massage therapists or chiropractors instead of the physical therapist, and then they argue with you. They really like the chiro, and they really like the massage therapist, and they think the massage therapist is as good as the physical therapist. And the physical therapist may have a doctorate in physical therapy and knows every muscle, every nerve, how the muscles function, all the relationships, and this massage therapist lays hands on and doesn't know what's underneath her hands. And so, these are problems that we have, and we have to advise them to go to a physical therapist. We have to document this in the chart because later when they sue us and they say we're bad people, and they want a huge judgment, it's going to show that they didn't comply with anything. They never went to the physical therapist. Or they went to a physical therapist who was a jerk who didn't provide good care, and we advised them that, and they just didn't listen. The physical therapist dismissed the patient before achieving results requested. There are times, no kidding, where the physical therapist will go like 10 visits and nothing's getting really better. Patient feels a little bit better, but none of the range of motion is getting better. And the physical therapist sucks, and they dismiss the patient saying, "You're done. I finished you." And it's really sad. And I will tell you something. When someone lays hands upon you, you fall in love with them. I mean, this is very well known that like psychiatrists who work with their patients, the patients fall in love with the psychiatrist because they're providing their innermost, deepest secrets and thoughts to the psychiatrist, and they fall in love with the psychiatrist. And the same is true of physical therapists. They are laying hands lovingly upon patients, and they fall in love with the patient. And the physical therapist does not provide good care, but the patient's in love with the physical therapist and will defend the physical therapist despite no results. But then later, that patient will hold me to account and you to account, even though the physical therapist did not provide excellent care. Or sometimes we'll see that the patient went to another physical therapist, not the one that we like. Now, not all men are the same. You'll hear me say this all the time. You can marry any guy. You could pick any physical therapist, no problem. Any guy, marry any guy, no problem. We know that's insane. Physical therapists have specialty areas, and some like manual therapy, some don't like to touch patients at all. It's just the way it is. And so we need to get the best possible physical therapist for our patient, and they need to go to somebody that we recommend or we've certified or talked to. It's very important. So the patient went to another physical therapist and not the agreed upon physical therapist. That's crazy, huh? Uh, if you talk to an MD, they'll tell you that one of their greatest, probably their most important, difficult problem is non-compliance. Compliance means to do the things that the doctor says. So the patients don't listen to the doctor and they don't get better. I mean, how often does a physician give a prescription and require like 10 pills over 10 days, and there's like they only take 5 or 4, and then they'll tell you, "Hey, I got some of those pills." It's because they didn't do the prescription the way the physician had ordered. And the problem with TMD patients is sometimes, not always, but sometimes they will heavily blame me, degrade me, make me feel bad, try to bring me to court, all kind of stuff, because they insist that I heal them without them doing everything needed. The cervical problems are integrated with TMD problems. This is, if you've got a TMD problem, you've got a cervical problem. If you've got a cervical problem, you probably have a TMD problem. They're integrated. And all the muscles in the neck refer pain to the face, the joint, the above the head, behind the eye, all over the place. And the patient saying, I'm having pain in my eye, in my joint. That's your area. You take care of that. But then when we look at the pain referral patterns of muscles in the neck, that's where they refer to. So we'll see a patient opening normally, 40 to 50, opening, 8 to 10 or 8 to 12, right and left. Muscles are fine. You palpate the masseter, it's not sore. Everything's fine. TMD is fine. Dental's fine. But then it's coming from the neck. And the patient doesn't want to go to it, perhaps because they think they're going to have to pay for all of it. But most of the time, people have medical insurance, and and their co-pays are like $25 or $50. So they can go, it's much cheaper than me, and it's covered by medical, and it's just a wonderful thing. Why would someone not want to go to physical therapy? It's not that big a deal, but they don't. And that's why on the bottom of the form, the patient self-evaluation form, we always ask, after a referral, the date that the referral was made, and are you doing okay? And you're going to see a lot of these patients, well, I never went, or I've only had one visit, or I went to one visit and I didn't have a chance to get to others. Then they start complaining at you about various pains that they've got, and it's from their neck, but they hold me responsible because they don't understand. They don't have dental degrees. And a lot of even dentists don't understand that pain in the face, pain in the joints, pain in the eyes, pain in the ears can come from neck muscles. So how do we avoid some of this crap? Well, the patient's in the chair. And with the patient's own phone, because they'll keep the number, right? So if they call on their own phone, tomorrow they got that number on their phone. Don't call with the company phone. Don't do that. Don't call with the Atlanta Dental Group. Have the patient pull their cell phone out and call the physical therapist right then. Have the patient call and make the first physical therapy appointment right there in the chair in front of you, right? While you're watching and helping. And again, have the patient use her cell phone, not yours, not the dental practice phone, because she'll have that on there. And also, if they call back, the physical therapist probably has a call identifier and call this patient back also. So you're tying them in and you're forcing her to make that appointment, right? It is so stressful, and the whole thing is stressful because I really want my patients to get better, to heal, to feel good, to sleep. Perhaps it's because I'm selfish and I want them to look up to me and say thank you. And I get my jollies like that. I don't know. But by making the appointment right there, you're making it happen, right? It's all happening. And then you can actually fax over the prescription. Of course, you keep the prescription, you make sure the patient has their prescription, but you can fax that over to that physical therapist. So there is a group of physical therapists that believe in hands-on, and they're a huge minority, huge minority. If you go to their site, the American Academy of Orthopedic Manual Physical Therapists, you go to the site, and I guess there's like 40 or 60 manual therapists in the state of Georgia, the entire state of Georgia, and there may be 6,000, probably more than 6,000 physical therapists. I don't know how many there are. So going to any physical therapist, they may not like doing hands-on work, but these guys, that's all they do. And we're ordering manual manus, hands-on therapy of the neck to mobilize the vertebra. So you pull up their website, which is AAOMPT, American Academy of Orthopedic Manual Therapists, and do it in front of the patient. So if you scroll down a little bit, there's a green area. It says find a member. You don't want to find a fellow because there's maybe 2 fellows in the whole state, right? You want to just find a member. So go to that circled area where it's red with the arrow going to it. It says find a member. And don't try to put a city in there because a lot of cities, there's only 60 of these people, right, in the whole state. So if you put a city in, it's going to say nobody's there. So it's better to go to the state of Georgia, just pull Georgia up and go through the whole list of Georgia people in front of the patient, and then get a physical therapist in the area that they are working in, and lo and behold, they can make an appointment right there. So if you force the patient to call right there in front of you, you know that the appointment was made, and you can sleep at night knowing that your patient, this TMD patient, is going to have necessary physical therapy done by a correct, certified manual therapist, not by anybody else, you know? So there are many different types of MDs. Like there's a podiatrist. I mean, there is a orthopedic doctor. There's a cardiologist. There's a nephrologist for the kidneys, right? You know, there's ophthalmologist for the eyes. Not all MDs do the same thing. Not all PTs do the same thing. So a lot of times, my poor patients, not knowing what the hell they're doing, trying to just conveniently thinking any man can be married. I don't mind, I'll marry any man. All men are the same. I don't mind. Any physical therapist is the same. I can go to any one, no problem. And they really think this way. And then they go to the wrong PT. They don't get the correct therapy. They waste $2,000, sometimes $3,000, and they never get better. And then they look at us like we're jerks, and they do, because they're naive. But yet they will blame these same people that are not intelligent enough to know that there are specifically trained PTs, are also not intelligent enough to know that if they don't get their neck taken care of, their TMD problem's not going to get better. So go to this website. I really like stories because stories highlight problems. And we had a patient who had Medicare, and we referred that patient to a physical therapist, and I wrote the prescription, but the physical therapist didn't know the rules. So the physical therapist said, gee, I've got a Medicare prescription. I can go ahead, since I've always gone ahead and did PT, physical therapy for patients with Medicare. The problem was she did not know that dentists cannot write physical therapy prescriptions. She just saw the prescription and said, okay, let's do it. And she did 10 visits for the patient, and it was $1,800. And Medicare didn't pay for it. And she tried to get the patient to pay the $1,800. The patient went crazy. The patient actually brought a lawsuit, little small claims action against her. She dropped everything and just gave away her 10 hours of work. We need to be very careful. I have never in my history of dentistry not wrote a prescription for physical therapy and sent it to a physician and the physician did not sign it. They always sign it. They don't see any problem with it. And it's just something they're going to do. So you do need to know who has Medicare, and these are people over 65. And you just got to always ask because it's a major mistake. If the patient has Medicare, then it's a little bit more trouble. You've got to write the whole prescription up, but leave the doctor's name alone because it has to be a physician. So this is a mother warning. Medicare pays for physical therapy only when a physician or MD makes the physical therapy referral. So how do we solve this? We write out the prescription, we fax it to the physician. This is an opportunity to establish a professional relationship with the physician. You've got to take this opportunity to say, I can make a relationship with the physician. I can make a relationship with the nurse practitioner of the physician. I can make a relationship with a physical therapist. Life is good. We're making all these social connections and internal referrals back and forth. So you need to take this as an opportunity, not a problem. A dentist cannot write a physical therapy prescription for Medicare patients. It has to be a physician. It's medical, not dental. And I try to tell this to you and tell this to everybody. I'm a dentist, and a lot of medical insurance sees DDS and says dentist no pay, dentist no pay. That's not part of medical. I'm a dental person. I'm not a medical person. Medical insurance pays medical, dental pays dental, and they're going to say TMD is dental. Why? They don't have to pay anything. They make a lot of money by screwing patients, and they really do. Um, and they do. They make outrageous profits by harming patients. Patients think that they're like grandma and everything's going to get paid. The nice thing with Medicare, it's unlimited PT visits. And depending upon the physical therapist, I think it's like $25 to $40 copay, very little relative to a lot of other plans. So we write the prescription, send it to the physician. The physical therapy is not paid if I write the prescription, and that patient will blame you. So don't be stupid. Please take care of your patients. Make them number one. Be aware of this problem and avoid problems for your patient because you care about the patient. You're not going to put the patient in a situation where they're screwed. So please be careful. Over 65, Medicare, don't write the prescription. You're writing prescriptions for me at 6 weeks, almost automatically for most patients. Therefore, you need to know who you're writing it for, what age they are, what insurance they have. So who are these people? It's almost always retired people. They're patients over 65, patients who are disabled and given Medicare. They have Medicare. Take a look at the patient's family file in Dentrix to see the age of the patient. You can also just ask the patient, do you have Medicare? And that will tell you, don't put my name in there. Don't put Mark Podolsky, DDS. No, no, no. Leave it blank. Then you call her physician, introduce yourself, maybe send some TMD stuff over with some referral cards, and then fax or email the prescription you filled out to the nurse practitioner or the physician, and you're going to look like you're smart and you're helping the patient and you're developing relationships. Uh, so people that are over 65 get something called Medicare, and Medicare is health insurance. It's insurance for their medical, and it's government sponsored, but it is medical. So only a medical doctor, an MD or a DO, doctor of osteopathy, those two practitioners, a physician, they're both physicians, can make a referral to physical therapy. So this gets crazy. I'm telling you this, and you say, well, Dr. Podolsky, you can't make a referral then. I'm sorry. These people do not get any physical therapy because you can't make a referral. No, that's not true. What we do is, please listen, we fill out a physical therapy referral without my information. So it doesn't have my name on it, doesn't have the Atlanta Tmd Institute, doesn't have my telephone number, but it's the same exact prescription. And then you send that to the patient's physician, and this is an opportunity to establish a relationship. And I want to. Unfortunately, one of the most things I'm so frustrated with, even the other day, we can make relationships with so many other healthcare professionals that have seen our patients, but we're just not doing it. And it's just a huge lost opportunity for us, for the other practitioner, for the patient. Everybody's losing out when you do not gold mine and find out all the related professionals. But in my, 39 years of practice, I have never had an MD refuse to sign the physical therapy order. Right? They think it's no big deal. So patients over 65 and patients who are disabled have Medicare. Just remember the name Medicare. Medicaid is for kids. Medicare is for old people or disabled people. Take a look at the patient's Dentrix family file to see the age of the patient. The age is really important. Over 65, most likely they're going to have Medicare. You can also just ask the patient, hey, do you have Medicare? And if they have Medicare, you're going to go through a different referral process so that Medicare will pay for their physical therapy. And it's a pretty good deal because they give the patient unlimited physical therapy visits, which most other insurance do not do. So many of our patients come from all over the Southeast United States, Huntsville, the capital of Mississippi, I forget what the name of that is, Raleigh, Durham, Tifton, Georgia, Talladega, Alabama, all over the place, close to Savannah. And they cannot often use our certified physical therapists, the ones that we've trained and trust. The difficulty is physical therapists vary in their talents, vary in their own interests, and also vary in their own personal ethics. Some of them are criminals, and they will see 5 patients an hour. No way can they take care of 5 people properly because they're making $180, right, per visit, 5 people. Geez Louise, you're looking at what, $900 an hour, and they don't care whether they deliver good services or not. And that's absolutely true. And you see this with, and we just saw one of our most accepted, wonderful physical therapy groups was bought up by a big medical company, and they started doing this huge number of people to make as much money as possible. And it is not about taking care of patients, it's about making money. And I, I want to make money, I do, but I want my patients to get better. I want to make money, but I want my patients to get better. And I want my patients to get better more than I want to make money because I don't need to make the money. So, geez Louise, they have to be very careful about choosing their physical therapist and also firing the physical therapist because so often they get connected to, when you lay your hands on another person, becomes a special relationship. Freud, who was a very famous psychologist, talked about something that happened with therapists, that the patients would fall in love with the therapist. They call it transference, I believe. So a lot of times the physical therapist would make good friends with the patient, but then physical therapist not doing what's required, and the patient is not willing to fire the physical therapist. Then the patient does not get better, and then the patient looks at me like, well, you did not get me better. Well, honestly, if they have a bad cervical problem, I'm not going to get them better, right? I'll get them, well, when I say I'll get better, but they're not going to be as healthy as I could get them. And I really want my patients healthy, happy, and functioning. And when they leave me, I don't want them to come back, right? I want them to live a wonderful life because of me and because of you. But thank God of all the things that I do, the working with physical therapists is the most difficult because of this problem that I mentioned. So it is extremely important. The more you educate the patient about their choice of a physical therapist, the better off you're going to be, better off patient's going to be. So you have a conversation with the patient. It is extremely important that you, the TMD assistant, have a meaningful and educational, you're educating the patient, conversation with the patient about how many physical therapists will accept cases when these physical therapists know that they will not be doing the manual therapy and spinal mobilization as we have requested. The physical therapist accepts the case because they see 10 visits, $180 a visit, it's close to $2,000. They're going to say yes, 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 even if they're not going to provide the service, right? And they're going to say, well, I did some stuff. I gave out a bunch of handouts and home therapy. And it's just so sad. But you need to make sure that the patient knows that it's extremely important that they get this specific type of therapy, manual therapy, manual from Manus, and then that they have to actually place their hands on their neck and then move their vertebra around and stretch their neck, because if they don't do this manual therapy, the spinal mobilization or spinal vertebral mobilization, the patient will not get better. Actually, the patient will improve because the muscles will be released, but the underlying problem will still be there, so it's going to come back again. All right, so the handout that we give them, a lot of times you can give, it's so interesting, people will sign consent forms and say, don't get any dental care. And recently we had a woman, we made a soft guard, and then she goes to her dentist and gets like a bunch of fill-ins. And she hurts like hell after that. Why? Because the soft guard doesn't fit, because all those fillings. And we were told her not to do that. It's in the handout. Then they sign the consent form. And I don't think that the patient read the consent form. And this is why it's so important for you to, when you hand out a handout, I got one person, unfortunately, just hands it and says, okay, he's got it, I don't care. And no, you want to sit and read the handout with the patient and then go over what problems might have, right? So the title of the handout is Finding a Good Manual Physical Therapist, so they know what they're looking for, right? So one, determine if your health care plan covers physical therapy, and if you are covered, does the health insurance require you to go to specific physical therapists? Some plans require, they have accepted therapists within their, like HMOs have their own physical therapists. So they just need to know what is the situation. Most of the time, health care does cover physical therapy. I've never seen one that is not, but I have seen ones that if they go to their own physical therapist, that part of their plan, actually sometimes their own company, it's covered better. So two, if your healthcare plan covers physical therapy only at specific physical therapists, print out the list of who you can go to. If the plan allows you to go anywhere, then find the telephone numbers of all the physical therapists in your area, and they can do that by just putting in Google manual physical therapist, right? So they can Google manual physical therapist and see who does manual therapy in their particular area. This is a lot of homework for the patient. It really is. And patients get frustrated because they don't want to do this homework, right? And they don't understand it. They're like, well, a physical therapist is a physical therapist is a physical therapist. I'm going to a physical therapist. Well, no, some physical therapists like neck, some like back, some like knees, some like, some are sports, some are post-surgicals. There are different types. And so they're going to need to Google in their area. You can write on this handout for them so that you can suggest ways for them to find their physical therapist. So the rest of this is like dealing with telephone calls, right? So you call the physical therapist that you're eligible to go to and ask the following questions. There's 3 questions that they all have to say yes. Do you do sports rehab? Do you do cervical work? Do you do manual therapy and deep tissue work? It should say manual therapy, spinal mobilization, and deep tissue work. If a physical therapist comes to the telephone to personally speak with you, then this is a really good sign, right? This person cares, wants to learn, and it's really important. And we ask these questions because sports rehab means you want to get the athlete to ultimate athlete condition to play sports. We don't just want to get someone walking. So a lot of physical therapists, they think that if they can get an old lady walking, they're happy. No, I want the old lady to be able to go home, cook, do gardening, walk, and I want that lady doing a lot of activity, and that's the objective, not just getting them walking out of pain. I used to think that getting patients out of pain was my ultimate goal, and it isn't. It's to rehab them so they're really, functioning very well. And the next thing, the name for the neck is cervical. And do they like doing cervical or neck work? Because some people just don't like it. Like they think that they're going to kill the patient. And I really mean this. They think, well, if I thrust too hard, I'm going to sever an artery and the patient's going to die. Well, there's like 0 recorded instances of this. I mean, it's theoretically possible, but there's just a very few instances of it in the United States. And do you do manual therapy spinal mobilization, deep tissue work, right? These are the questions, all must be yes. And if the physical therapist comes to the telephone to personally speak with you, with the patient, that's a really, really good sign. That means that that physical therapist wants very much to help people. So we're encouraging the patients to do their homework and find the very best physical therapist that they can. So once they've called around and they answered all the three questions, and now you've got two, three choices. Next thing would be visit the websites for all of the physical therapists who answered yes. Just go to the website, look at how big the organization is, some of the feedback, at the location, and just review the websites. And then you want to determine, the patient needs to say who they would like to go to, determine who you want to go to for your physical therapy. They give us that. We don't give them, The difficulty is when we make a referral, they hold us responsible for the excellence of that particular physical therapist. Like I traveled all this way to your physical therapist and I didn't get better. Well, here we go. We can't guarantee the work of someone else who's not part of our organization. And that's part of a problem. Like even recently, the young lady that I referred to is starting to change. Like she didn't get the head bending on one of my patients, right? And the patient's having problems. And not only that, now she's working on some other things like the back and the legs. So didn't get the result I asked for, and now she's messing with my patient elsewhere. And I'm not happy because it tells me that her professionalism, she is questionable because she may be a good physical therapist, but she's not focused on what I would like to achieve in my patient, my treatment success, right? It's very important. So this is step 6. Call the physical therapist who you have chosen. In other words, patient chooses a physical therapist, and ask the physical therapist to send physical therapy prescription pads to Dr. Podolsky. Most practices have physical therapy prescription pads, and we would like to have their prescription pad. We don't need to. We can use the standard one, but it's kind of nice if they send it to us. If the physical therapist refuses to do this, send us the pads. It's usually a bad sign. Because a really busy, good practice has their own physical therapy prescription pads, and it shows their interests, their abilities, and what services they provide. Because every different physical therapy company has a different pad, has different emphases, different types of services. Not all of them offer the same services. Not all of them offer manual therapy. We'd like to see this on the pad. It's a good sign. And the patient is given my information, right? Dr. Mark Allen Podolsky, 1640 Piedmont Avenue, Atlanta, Georgia, 30324, or the Atlanta Tmd Institute, right? So Dr. Podolsky's email is office@atlantadentist.com. Fax is 404-873-2231. Telephone for the Institute is 404-876-8123. So I am really concerned about helping patients avoid problems with their physical therapy. I'm not the physical therapist, but is my patient. So 7 says to the patient, please call your insurance company to see if a dentist, Dr. Podolsky and me, can refer you to a physical therapist. Or if your insurance only allows physicians to make physical therapy referrals. This is a problem because I'm not a physician, MD, medical doctor. I am a DDS, doctor of dental surgery. Got it? So crazy. And in this particular case, sometimes patients will go to a physical therapist, get 10 visits, and find out later none of it is covered, not a penny. We did have this happen. I had a physical therapist at Northside Hospital area, and she took this patient of mine who was older and did 10 visits, found out that the lady has Medicare, didn't confirm the insurance first. This is just a one physical therapist by herself. She didn't confirm the insurance first. And as a result of that, get this, she did 10 visits. Then the insurance said, we're not paying you. The referral came from a dentist, not a physician. Medicare does not pay a penny for any dentist referral. Sorry. So the physical therapist turned around and asked for the $1,800 for the 10 visits from the patient. Well, the patient went crazy because the physical therapist never talked to her about insurance repayments or co-pays, nothing. And then the physical therapist threatened our patient, and the patient brought our physical therapist to court, small claims court, and won because the physical therapist had misrepresented everything. And so it was sad. So physical therapy for Medicare patients can only be prescribed, written only by an MD. So now we have to stop, look, listen, roll. We write our prescription without my signature or name. We send it to the physician. And in my almost 40 years of practice, never ever once, not once, did the physician not sign the physical therapy referral. The physician signed it. It's covered 100%. All right. So this is very important that the patient looks into this because we don't want a mistake. Then the patient says, well, it's not covered, so I'm not going. Well, it's not covered because you should have got your physician. Well, that's your responsible, Dr. Podolsky. Well, we didn't know. You didn't tell us. Well, you're supposed to know my insurance. No, I don't need to know your insurance. You need to call your insurance company to see if a dentist can refer you to a physical therapist or if your insurance only allows physicians. And if it's physician simple, we'll just send the referral to your physician. He'll sign it. You'll go get it. That's all. It'll be covered. So if the patient, and patients are lazy, they don't always do what they're supposed to, but they get real mad when they have to pay money. But 8 is if your insurance company only allows physicians, MDs, to make physical therapy referrals, after Dr. Podolsky writes your prescription, he will scan it and send it to your physician. You, the assistant, will, our Tmd assistant. So Medicare only allows a medical doctor or physician to write a physical therapist prescription, refer to a physical therapist. So if at all or part of their physical therapy is covered by Medicare, do not go to the physical therapist without your MD, your general provider, your PCP, primary care provider, signing this referral, not Dr. Podolsky. Dr. Podolsky will help you, but you need to get your insurance straight. It's your insurance. You need to know it. And so many people, they don't take the time to learn their own insurance. You know, they'll call, oh yeah, I got dental insurance, and they'll give us the medical. Oh, I thought my medical covered dental. No, it doesn't. Your medical covers medical, doesn't cover dental. This happens a lot when we're confirming insurance. The Atlanta Tmd Institute is proud that this concludes the first half of the POHG6 course. There's a second half. Please go on to the second half. Much thanks for watching the video.